state now offering money to get more families vaccinated against COVID-19. Here to explain is Dr. Shira Doron, the Chief Infection Control Officer for Tufts Medicine Health System. Dr. Doron, thanks for joining us.
Great to be back.
As you know, Dr. Doron, most public schools in Massachusetts are closed next week for February break. So we learned today that public health officials are taking that opportunity to boost vaccination rates. They're offering $75 gift cards to any resident who receives a first dose, a second dose, or a booster at one of the state's Get Boosted clinics. What do you think about that incentive, and do you think it'll work?
You know, pre-COVID, there was some research showing that cash incentives can work to increase vaccine uptake. But so far, the studies done during COVID have not shown a meaningful impact on vaccination rates as compared to places that didn't use those incentives. That being said, I'm in favor of cash incentives because to me, every single additional vaccinated individual is a potential life saved.
Okay, so let's talk about the vaccination rates. Which groups are causing the most concern right now, in your opinion?
Well, if you just look at fully vaccinated individuals, meaning at least the first 2 doses of Pfizer or Moderna or 1 dose of J&J, we still have a gap in vaccination by ethnicity, where only 68% of Hispanic Massachusetts residents have been fully vaccinated as compared with 76% of Black and 79% of white residents. We also have much lower vaccination among 0 to 4-year-olds at 14% and 5 to 11-year-olds at 54%. And we have county level differences. Both Bristol and Hampton counties have less than 70% of their residents fully vaccinated.
All right, so we know that Massachusetts has one of the highest vaccination rates in the country. Looking at all age groups, about 80% of us here are fully vaccinated. About 62% of people are also boosted. The boosters have been out for quite some time now, so do you think we're at that point where it's unlikely the numbers are going to get much higher than that, and are you okay with that?
You know, believe it or not, we're still vaccinating over 1,000 people a day, most days in Massachusetts, so we shouldn't give up. But I certainly wouldn't expect any major upticks in that vaccination rate until the next time a new version of the vaccine comes out. Now, while the FDA and the CDC have opted for a very simple message, which is that everyone over age 6 months should be vaccinated and get a bivalent or updated booster, the fact is it's more important the older you are and the more high-risk conditions you have. And we do have a higher rate of vaccination and boosting among older people in Massachusetts. Over 80% of people over age 65 have had the booster. So that's why, despite low uptake of boosters overall, we thankfully didn't see a major surge in severe disease this winter.
Okay. Dr. Shira Doron, thank you so much.
Thank you.